Hey everyone, welcome back to another Fun Fact Friday live here at University Animal Clinic. I am Dr. Sam, and today I thought I would answer all of your questions that we get asked pre and post surgery, why we do some of the things we do or request of you some of the things that we request of you. So we're going to call this Surgery 101 for pet parents. So the first kind of thing that we will always recommend prior to surgery, and that is blood work. And I think most of us kind of know why that's so important. You know, anesthesia has metabolism through some of our organs, liver, kidney, things like that. And so we want to know that those are all functioning normally before I'm about to kind of stress them a little bit with drugs that we're going to use for anesthesia. So having that is really important. Also, when we talk about cutting procedures, so spays, neuters, mass removals, I want to know that their blood is clotting properly, that they're not anemic, we don't have any evidence of infection, and that's all seen in that blood work. So extremely important there. And then kind of as we get closer to that surgical procedure, we will have you schedule a drop-off time. And the day before, we will call and let you know about food and water. And why is that so important? You know, our pets under anesthesia, they're kind of laying down, so they're horizontal. And then on top of that, some of the drugs can make them a little nauseous. So preventing them from eating and drinking helps us ensure that there's not going to be any vomiting of food, that there's a risk that they could aspirate. So if they were to vomit and then breathe in before we get them intubated, there's a chance they can breathe some of that ingestal or even fluid into their lungs, and that can cause infections and can be really detrimental. So we recommend no food or water after midnight. Sometimes just a little bit of water is okay. And this is to help prevent them from having any kind of aspiration of that food or fluid and help reduce the evidence of nausea and vomiting under anesthesia. We then go ahead with that procedure. Our pets are here. You know, why do we ask you to drop off so early? I get this asked often. You know, most of the time we're not starting that procedure till 9, 10, depending on which pet, you know, in order that we're doing. But I also get asked, why are we dropping off then at 8:30 in the morning? And that is because we need to pre-medicate your pet. Your pet gets a pre-exam by the doctor, and all of those things take time and have an order. And so having your pet here gives us that time for us to do their exam, pre-medicate them, monitor them while they've had their pre-meds prior to that anesthetic procedure, and just to help the flow for the doctor and for the nurses to make sure that everything happens in a timely fashion and in a safe fashion. And then it comes time for pickup. And, you know, we will generally schedule that pickup for a specific time, 4:30, 4:15. And that's so that you get that dedicated time with your surgical nurse. So that surgery nurse can go over everything that was done for your pet today, what your post-op instructions are, whether it's that their pet needs to wear an e-collar or has medications to be given, or what meds did we give here that you don't need to give at home. And all of those conversations take time. We also want to make sure we have time set aside for any questions that you have for the nurse or even for the doctor. And so scheduling that pickup appointment allows that we have a dedicated nurse available to talk to your pet, to go over all of that information. So really important that when your nurse gives you that pickup time, that we're here at that time so that you get that dedicated time with your nurse. And then you will get a phone call the next day from us. That's to check in with your pet, make sure everything's okay. We want to know if anything's going wrong so that we can help you sooner rather than later. Of course, you know, we can get you in before the weekend, say, and recheck something if something doesn't seem right, if your pet seems out of sorts or nauseous after anesthesia. So I hope that gave you guys a little bit of insight into some of the reasons we ask you to drop off when we do our pickup, when we do blood work, things like that. All of our pets get IV catheters, so you'll see a bandage when they go home. That also can come off later when they get home, but that's just after we remove their IV catheter. They get a little bandage after that as well. And I often get asked, what's that for? So if you have questions about what happens during anesthesia or when your pet is here dropped off with us in the treatment area, leave those below. I would love to answer them. If you have ideas for the next Fun Fact Friday, you know I've been doing this for a couple years now, so I am always looking for your ideas. I always want to talk about what you want to hear about, and give this video a like and a share. Bye.